Thanks for staying with us. So it's Tuesday, we have to discuss something about health. And today we're discussing the landscape of healthcare in changing every day. It's actually changing every day. What used to be a straightforward process of heading to your local healthcare provider for diagnosis and treatment is rapidly changing. You can receive your diagnosis and care through digital networks. Today on the show, our guests will be discussing the barriers to telehealth adoption in Nigeria and possible solutions. Joining us on the show is a health innovation expert and CEO, CRIB MD Ifeanyi Osai. Welcome to the show, Ifeanyi. Are you there?
I am.
Thanks for joining us on the show. So tell us a bit about this telehealth method, like remote diagnosis and treatment of illnesses and sicknesses. Tell us about that, please.
CRIB MD is basically Uber for doctors. We do doctor house call and telemedicine. Using technology, we make it possible for you to get healthcare from the comfort and safety of your own home on your own schedule. So the idea is to use technology and remove the barrier. So you basically don't have to, travel in Lagos traffic or in Port Harcourt or in Abuja traffic, sitting all day in traffic waiting to go see healthcare. Using our app or our website, you can just push a button and, your doctor will be on your phone. So if you have a phone, you have a doctor. That's essentially what the idea of telemedicine is. If you have a phone or you have a computer, then you have a doctor.
Okay, so this is something not necessarily new. Many people are already sort of doing this with mobile apps where you can talk to a doctor, put in your diagnosis, and then sort of get a bit of referral. But how can the real bulk of medical challenge that we have in Nigeria is for the middle class and below. And many of those don't even have access to smartphones or apps. So how are we reaching out to those people? There are villages that don't have hospitals that you can't get to in 30 minutes. How are we going to break the barrier to get towards them?
Yeah, so how we bridge that gap is basically, so one thing we do at CRIB MD is that we offer offline services, which means even if you do not have the app, you are still able to give us a call with your regular phone, which most folks have in Nigeria. You can just call us and we'll send a doctor to your home directly. So you do not necessarily have to do telehealth if you do not have that capability. So, but I think on a broader note, I think that is something the Nigerian government can help with.
Okay, in Nigeria, the network is always bad. How can you reconcile it? Because I will be trying to say, so my head is paining me. You will be saying, pardon, I can't hear you. I can't hear you. How are you going to overcome that? Then Wi-Fi, internet is always, no service today, no service tomorrow. So is this something that can really work in this part of? This is what I'm talking about. Our network is always bad. How are you going to synchronize that with telehealth?
So, I do get that. So I think as Nigerians, that is a conversation we honestly need to have with perhaps our Minister of Information or something, or at the federal level, because it's a shame that in the 21st century that folks haven't had time connecting on phone. Talking to each other or their Wi-Fi working, why companies like MTN, are making billions of dollars. That doesn't compute, It's something the federal government can step in and, help solve. Most countries in the world have passed this stage. We're talking 5G now in most places.
Very quickly, I want to ask you, part of diagnosis is feeling, touching. How can you make an accurate diagnosis on somebody you cannot see? How do you do that remotely?
We offer tech products, right? So, and using technology like, say, an Apple Watch or like a Samsung Watch, we're able to, take your pulse remotely. We're able to monitor your blood oxygen level. We're able to monitor a lot of things. So it's called remote monitoring. So that is one way we use that. We integrate technology into our platform, to deliver better experience and better healthcare. And so the idea is not that telehealth will fix everything. So it's one way to fix stuff, but sometimes you do need the physical presence of the doctor. And in those cases, CRIB MD can send a doctor to your home. So we do doctor house call and we do telemedicine. So.
Great.
But we also do have ability to remote monitor, so we are able to, see you through sensors, even though we are not there physically touching you. So that is what technology is doing,
Thank you.
To being able to render that service without necessarily being there.